All right, everybody, let's get started. We are so excited to have you here today for our March Advocate webinar. Our topic today is state implementation. We have a really awesome program of work that we're going to share with you today and give you some full details on. And Michelle Guadalupe, our Director of State Legislative Affairs, is going to be on to help share this program with you. We're so excited to give you all this sneak peek at what we're doing this year and helping to make sure that everybody who has new patient protections know that they are in place and that they are able to fully access and embrace them. If you have questions during the webinar, I want to invite you to ask them in private. If you type them to me, do it in the Q&A section of your browser. You can also enter them into the chat feature. At the end of the webinar, we'll address any questions that come in, and we'll also provide you an opportunity to ask them live by unmuting your line and just asking them directly. So keep that in mind as we go through our slides. Before we move into our state implementation program of work, I wanted to just give you guys a brief update on our Platinum Ambassador Assembly, which took place just a few weeks ago now. We had an amazing experience with our Platinum Ambassadors in Washington, D.C. We were able to have over 137 meetings on Capitol Hill to advance our legislative asks on topics like reforming step therapy nationwide, ensuring children's access to specialty care, increasing appropriations for public health programs at the NIH, CDC, DOD, and encouraging people to join our Congressional Arthritis Caucus. We had a really, really awesome turnout and a wonderful bunch of people who were here with us live on Capitol Hill, but we also had an amazing turnout of people who joined us online. So I really want to tell you about our social media campaign that we spoke about on last month's Advocate webinar. We discussed our hashtag Advocate for Arthritis opportunity and encouraged you all to share pictures holding signs that let us know why you were an advocate for arthritis. We had a very successful campaign on Twitter, on Facebook, on Instagram, where people shared their photos of their reasons for advocacy all across the country, all across the world. We had over 11 million impressions of our hashtag across the internet. So that means 11 million individuals or 11 million users came on and they saw the great work that we were doing online. I wanted to show you some examples of our photos. So we have some on Twitter here, which I think are great. Some of my favorite ones actually included pets. We had lots of people who showed their animals in their pictures. We had lots of people who showed their family members. We had lots of people who showed their themselves and their neighbors and their friends, and the reason that they advocate for arthritis. Here are some of our great Instagram pictures. And some of the great things that we saw, we had some celebrity engagement. We had Anna Villafante join us in our Advocate for Arthritis campaign. We had presence from Australia and Germany. We were international in sharing our stories. And most importantly, we were able to really amplify our message. So thank you for participating. Thank you for contacting your legislators. If you used our social media campaign as an opportunity to fundraise, I hope that it benefited your team. And if you did, let me know. I would love to hear how that impacted your fundraising that week. We had a really great time, and it was just such a special thing to see all of you and your pictures online. There was nothing more special for me that day than getting to sit down at my computer after a long day on Capitol Hill and get to see all of this amazing, amazing online presence. It really helped to amplify our message, and I just thank you from the bottom of my heart. We had a wonderfully successful Ambassador Assembly, and so much of that was because of you. At this point, we're going to shift gears, and I'm going to pass the microphone on to Michelle Guadalupe, and she's going to share with you more about our state implementation plans and how you can engage. We are so excited to roll this out for you, and I welcome Michelle on now.
All right. Thanks, Julie. I first wanted just to kind of reiterate that everything that we do is really driven by our advocates. And so I just wanted to kind of show a slide that talks through, I know we've discussed this in the past, but we had done a survey of our advocates, and you all had really kind of talked through what you wanted to see us do, moving forward in 2018. So this is just one of the slides that we have shown in the past, but really talking about reducing those barriers to patient access, promoting those patient protections once legislative victories become law, which is what we're going to talk about today, additional ways for advocates to engage locally, and then, of course, with our state advocacy committees. So it has been a very busy legislative season, and I just wanted to briefly say where we're at. It is now at the end of March. We've had 11 victories and counting, and that is thanks to our advocates. Many of these victories, we had our advocates testify, do social media alerts, write emails to their legislators, and in fact, just this week, we had West Virginia and Wisconsin both had their biosimilars bills signed into law. In fact, Wisconsin bill signing is today. So again, I wanted to thank everyone for this. We're still expecting additional victories as there are some bills currently with the governor. So as I mentioned, we've had 85 victories between the years 2014 and now. And if you notice, for those of you that have, the slides up in front of you, on this slide, you can kind of see where our legislative victories have happened, and you can see where we're going with our state implementation project. Those states are highlighted yellow, and we will also list them out on our next slide. But as you can see, we've had some great successes, thanks to all of you. So our 2018 state implementation targets. We are focusing in on 3 issue areas: step therapy, prior authorization, and out-of-pocket. And you can see on this slide the target states for each of those areas. Now, we understand that that's not all of our victories, but we wanted, since this is a newer area and really doing a state implementation plan, we wanted to starting out with these 10, working through the process with those 10, and then, looking to the future, looking to see what we can do in additional states and with some of our new victories. So with step therapy, that would include Colorado, Iowa, Illinois, Missouri, New York, Texas, and West Virginia. Prior authorization would include Ohio and Indiana. Out-of-pocket would include Washington, D.C. Now, all of these states have had these laws. They have been enacted, and we are just really excited to roll this out in the upcoming months so you can see exactly what this means for you. And now, don't worry, again, if you do not reside in one of those states, we will be, we are continuing to kind of plan for the future and look at, kind of tweaking what we've been doing in these target 10 states, and we'll be working on some future plans for some of our additional states. All right, so now that we've said the issues, we've said the states, now let's talk about how we will do this. So this is going to be a multi-part process, and next month in mid-April, for those 10 states, we will be working to get an email out to our advocates. It will have a pre-survey plus an educational video on the issue. We really want to do that pre-survey because we want to know, have you heard about this particular new law, or have you experienced the issue personally? Even with these, laws being enacted, we still want to know, are you experiencing any issues? We have these great story banks that we can capture, any of those particular stories. And again, we just want to make sure that we are continuing to kind of mold any of our, our plans based on feedback that we are getting from our advocates. So I talk about this educational video. On the next slide, again, we have our prior authorization issue. We have step therapy. We have out-of-pocket costs. For each of these emails, we are actually having our state policy director, Ben Chandok. He is going to be providing, I think, a really good explanation about, okay, what exactly does this mean, prior authorization, or what does step therapy actually mean? Because we know sometimes some of these are newer terms for you, so we really want to kind of set the stage and make sure you knew what the issue was before we go into the real specifics on what does that law actually do and what are those patient protections. All right, part 2. After the advocates get that, background information on the issue and that they participate in a pre-survey, we will then be sending a video about the new law and what that really means to patients. And we are also going to be making sure that that you have an easy-to-follow one-pager. We definitely want to make sure that you can take this information and share it with your friends, family, providers, colleagues, whoever it would be, because all of these state laws, they are not just specific for people with arthritis. They are specific to really anyone, who is experiencing some of those different issues with getting their medication. All right, continuing on with part 2. Many of the videos that we will be, providing to you all, we want to make sure that you will, by the end of the video, that you will learn about the law, making sure you know about your rights. Many of you on the phone may have already experienced this, which I would hope not, but if you've ever been denied your prescription with your insurance company, learn what to do. Many of the ways to do this is through filing a complaint and also filing an external appeal. So we want to make sure that we are providing you that information via this video, but then also, making sure that you all have that one-pager. Now, what I wanted to do is sometimes I know, okay, what does this actually mean then? We have been working on some presentations already, and I wanted to highlight one of them, and I'm going to be providing you guys with a few slides that are excerpts from our West Virginia step therapy patient video. And I really want to say thank you to one of our team members, Pam Fields, who has been really working diligently on kind of coming up with some of these initial presentations for all of us to use. And I just really wanted to give that caveat that this is excerpts from our West Virginia presentation. And, every state's law is a little bit different, and we will be providing you with targeted information for each of the 10 states. But we really just wanted to give you an idea of what these slides will be looking like. So again, this is specific to West Virginia, but when these go out in April, May, and June, they are going to be really targeted to those 10 initial target states that we have. And at every point of the way, I had mentioned Pam's name. Your state directors are here to help. And, if you ever have any questions, we can definitely get you in touch with them if you haven't already met them. I know Julie has, we'll have her contact information. I've had mine. So you can, call us and talk to us at any point. All right. So in terms of this patient education video, when you receive the link to the video, we will definitely want to have just a quick reminder of the issue. So in this case, we would help define what step therapy is, and that is that protocol or program that establishes that specific sequence in which prescription drugs are covered by a health plan insurer. And we really wanted, in this particular case with West Virginia, to thank our bill sponsor for the work that he did. We had some amazing champions. Not only our advocates championed for these bills, but we had some fantastic sponsors that did that as well. So after defining what the issue is, we will be going into such topics as, what are your rights? And in the case of the step therapy law here, just making sure, that there is a clear, convenient process by which a patient may request and, if appropriate, receive an exemption to the step therapy protocol. And, of course, having these easily accessible on the insurer's website. If you ever are at a point where your prescription is denied, We also have slides that kind of talk through what would you do in that case if your prescription is denied. So on the next slide, it talks about, okay, what to do. What if your prescription is denied? There are multiple steps that you can take. It includes, talking with your pharmacist, talking to a healthcare provider, and looking at some different opportunities there. But what we know with our step therapy laws is that there are exemptions in place. So we want to make sure that you are well aware of what that means in terms of the appeals process on the next slide. And again, a lot of this is open communication with your doctor, having conversations with your insurance company, and the most important thing that we will always, tell you as you're working through this process is, if for some reason you did get a denial, is to make sure that you keep copies of any of those insurance letters, information, because again, with these new laws in place, we really have that information to arm both yourself and your doctor to continue working with your insurance company. So the next two slides just give additional input and information on how to work with your insurance company and how to do the appeal. So as you can see here, again here, keep notes on all conversations. So if it continues to happen that your insurance company is not compliant, then we would provide you with information on how to file an insurance complaint. So that's on the next slide. So again, this is specific to West Virginia, but each of the states that we do will have specific information for your particular state and how to do this. And then the last slide on this section is, again, looking at if there's any external review processes. So I know this was just a really quick excerpt about specific to West Virginia, but we really wanted to make sure that you just had an idea that through this process, that first email we send you really goes over the issue. The second email will talk about what are your rights as a patient, and if you have to, you can have the different ways in order to file a complaint and get the process moving. And then we will definitely round out our plan with state implementation with that third email, including any highlights, a link to the one-pager, and a post survey. So we have an aggressive timeline. We are going to be, working on this moving forward between April, May, and June. But again, all of this, we wanted to make sure that you have easy-to-use information that you're able to then share this with your family, friends, and healthcare provider. All right, so then again with, future plans here, we want to see how the first 10 states go. We really are, our initial thought process is wanting to give you guys, the resources so that, these videos you can watch on your own. And we will be here as support system. We're also, thinking through, and we're going to be having this in the survey to see if this is information you would want, but potentially add in some social media components and opportunities to ask any of your questions live with us. Because we know that every case is going to be slightly different, but we really want to make sure that this is easy for you so that you have the information at your fingertips. So based on what happens in the first 10 states, we'll make those adjustments, and then we'll continue to educate advocates in additional states because, as you saw from earlier, we've already had 11 state victories this year. So all of these different videos, we will be sharing with you all through email, but we will be having all of the videos also uploaded to our video training center, which is one of our newer a newer feature that we have on our website. And this webinar series today will be saved to the video training center within our arthritis.org website. So you can actually see past webinar series, but all of these different implementation videos will be saved here so that you can watch them at your leisure as well. So I know that was quite a bit of information to get through, and it was meant just to be a sneak peek at the kind of information that you'll be getting, as we do our implementation plans. We certainly understand that sometimes, thinking about, insurance and thinking about, coverage, there's a lot of things I know go through everyone's mind every time you have to either pick up a prescription, you just want to make sure that you have that accessible to you. But what we really want to do is make this as easy as possible, give you the information, provide you with tools and resources in multiple ways. So having it through our email links, but then having it, live on our video training center, and then again having some opportunities in the future for you to ask questions live. We want to make sure that we kind of include all of those aspects in this project. So with that, I'm actually going to turn it back over to Julie and for kind of the remaining steps in this webinar.
Thanks so much, Michelle. Yes, so we are very excited to roll out this program, not only in these 10 states, but for our whole nationwide grassroots advocacy community. We want to make sure that not only do you have the opportunity to follow along as someone who is in one of these target states, but also as somebody who wants to see what's going on in their own state. So while our 10 states are what we're looking at for this calendar year, as we move forward with our program, you can expect to see these types of activities for any state that has a victory moving forward. One of the other things that we want to really encourage you guys to do is to share your story with our team. So if you're not in one of our target states but do want to take action right now, we have lots of story banking opportunities for you that are live in our Action Center right now. And these story banking opportunities encourage you not only to look and think critically about your own experience with our positions or issues that we focus on, but also to take the next step and think about connecting with your insurance commissioner to talk about those experiences as well. So for anybody, when you think about how you can engage with our state implementation plan right now, I want you to think about our story banking program. Please consider going to our Action Center, and going in, you can answer our prompted questions, and then your story can be used from our perspective, not only to connect you with opportunities if there's op-ed opportunity or a testimony opportunity, but also to encourage you to connect then with that state insurance commissioner to help close the feedback loop and make sure that your voice is heard by important decision makers in your state. With that, I'm going to open it up for questions, and some of the questions I think that we probably addressed from our Q&A section. So if you're not in an initial target state, please go on to our story banking system, share your story with us, and we'll help connect you with opportunities to engage. And consider working with your state directors to really make sure that you can get the appropriate talking points, get the appropriate materials that you can use in talking with your policymakers and decision makers in your state. Before we move on to questions, I know we had just one question, excuse me, before we move on to live questions, one other question that we had is, what are our 10 states? And our 10 states, just to reiterate, are for step therapy, Colorado, Iowa, Illinois, Missouri, New York, Texas, and West Virginia. For prior authorization, Ohio and Indiana. And for out-of-pocket costs, Washington, D.C. So these are our 10 states. And any remaining questions, I invite you to ask either live or in the chat feature by simply hitting #6 to unmute your line, or just typing them away to me. Awesome. And while we wait for any other questions to come in, I'm going to be sending out a recording of this webinar along with a PDF of our slides in our next edition of our Advocacy in Action newsletter. And that'll come out promptly after we get all of these resources live online.
Hi, I had a question.
Great.
Oh, you talked about the story bank and opportunities to write op-eds. Are there any op-eds that are on the site that we can see that people have written in the past about arthritis?
Absolutely. So we have a really great toolkit online. It's our advocacy toolkit, and it provides you lots of different tools and resources that you can look at for draft letters, for op-eds, draft letters for letters to the editor.
I'm real familiar with that, but it just about previous ones, like the ones that have actually been used.
Yeah, so in that toolkit, we have examples. We've just updated the toolkit with a new batch of information just this month. So we have the examples that are contained in that toolkit are successful op-eds that we've used in the past. And if you'd like to see ones maybe specific to your state, we can send on some links that we've used specifically. So reach out to your state director, and they will likely have some resources that they can provide you.
Okay. Thanks.
Awesome. Another question we have is, will there be specific state events launching this? Or is there something aimed at the state insurance commissioners or legislator? Our specific state events are going to be our policy issue web or videos that we provide with those patient protections. But like Michelle had mentioned, we're also hoping to get your feedback by state in our pre-event or our pre-implementation survey to see what's the best way to communicate these out to you. So we're thinking about harnessing the power of social media to make sure that we can close the feedback loop and provide live answers to questions. And the following question about, is there something aimed at your insurance commissioners or legislators? Yes, we are hoping as a part of these patient protection videos to include the easy step-by-step guides on how best to communicate with your insurance commissioner. And as a part of our story banking links, at the very end, after you shared your story with our Arthritis Foundation team, you can click on a link that will direct you to a page where you can find your insurance commissioner and identify the best way to communicate that story with them as well.
Yeah, especially with insurance commissioners, we have heard loud and clear. Meeting some of the advocacy team that we've actually talked with some insurance commissioners, and having that opportunity. Yes, we want to hear your story and learn about it, but they say that if any changes need to happen, we need to know that there's an issue. So that's why we really want to have that piece included in on the story bank, and just in general throughout is, they really look at numbers. They really look at actually getting the physical kind of evidence if there's any issues, not just anecdotal from, some of us in the patient community.
We have one more question about step therapy and the specifics of the law, of the model legislation that we've used. And for that question, if you have questions about the legislation that has passed specifically in your state, because these are nuanced bills, I encourage you to reach out to your state director who can let you know exactly the law that has passed and how it will be enacted in your state for right now. But we'll also be going into those specifics when we have our patient protection videos. We'll go into every bit of the law and how it impacts our patients so that we can make sure that they really understand those new protections and how best to use them. Another question just came in. When you bring issues to the insurance commissioner versus the attorney general when your insurance company is in violation. So I'm going to direct this question to Michelle. Is it best to direct your concern or your issue to the insurance commissioner or to the attorney general when your insurance company is in violation?
Well, what we've been hearing, in working with a lot of our different coalition partners, that a good line of defense first, of course, is working directly with your insurance company, because many times before you can even do that next step with insurance commissioner, you have to, show that you have, you and your doctor have worked with your insurance company. We really look at then that next step being with the insurance commissioner, because they have a lot of guidance and a lot of, they do a lot of communication between the insurance commissioner and the insurance companies. I know in many of our states they've actually have issued what's called a bulletin, and when these new laws do hit, they will issue a bulletin that goes out to all of the insurance companies, making sure that everyone is aware of the new law and what that really means. So I would definitely recommend doing that next line of defense, going to the insurance commissioner.
Thanks, Michelle. I am not seeing any other questions coming in, so at this point I'm going to close this section of our webinar, but if you do have further questions, you can reach out to me and I can help direct them to the appropriate state director. You can reach out to your state director specifically, but my contact information is listed here. My email address is jeller@arthritis.org, my phone number 202-843-0094, and if social media is your favorite way to communicate, you can reach out to me on Twitter at JulieEllerAF. Thank you all so much for joining us today. I hope that you learned a little bit more about our state implementation program, and please, if you have any further questions, send them my way. We're excited to roll out this new program. Thanks so much.